Hi, if you're 3 months after a gastric sleeve or any bariatric surgery, this information can be useful for you. After 3 months of the operation, we expect patients to be in a solid and really balanced food. Patients should be eating on almost normal food. In terms of meat, many patients should be able to eat white meat like fish and chicken, and many patients can start taking red meat. We recommend patients, in order to be more comfortable, to introduce red meat as ground beef. And after they tolerate that, they can try to eat solid meat as a steak. But this is often uncomfortable for the patient in the first months. And if it is uncomfortable for you, I recommend you to wait for a while and then try again a few weeks later if you are uncomfortable with red meat. You should have a balanced meal. You should use a small dish, a small portion, and as I told in the video before, you should take 20 minutes for a meal. Take your time. Don't eat in 5 or 3 minutes. Sit down, take your time for a meal, use the 20 minutes to eat. But if after 20 minutes you haven't finished, you should stop. Stop, stand up, don't continue, walk around and move. And if you like that food a lot and you want to keep it for the next meal, that's going to be for the next meal. It's not a good idea to eat every hour a little bit. You should stop that food, and then if you want to try that food again, just keep it in the refrigerator for the next meal. And then when you're going to take a snack, you're going to take something else, not the same thing that you had for breakfast, for lunch or dinner. You should be very active. You should have been back to your normal life. And remember that exercise is very important. At this point, your weight loss can be slowing down a little bit, which is normal, and can be irregular. You get to a point where you're going to have 2 or 3 weeks without losing weight, and then 2 or 3 weeks when you lose weight again. If you are having a couple of weeks without losing weight, don't worry about it. That happens in most of the patients. What you have to check is that you're doing things right. You're not eating sugar, you're not eating sweets, and I recommend patients not to eat some very sweet fruits that can slow down the weight loss. Those fruits are grapes, mango, and banana. Those are the fruits that have most sugar and are very well tolerated. Even if they don't have more sugar than other fruits, they are very well tolerated, so the patient tends to have bigger portions. If you're going to have juices like tangerine or orange juice, use 1 portion a day and change the fruits and change the juices. Don't stay on one food all the time. Remember that after 2 weeks after the operation, you should have moved to a solid diet. I recommend you not to stay taking and drinking soups. The reason of that is that you are going to be able to tolerate bigger and bigger portions of soups, and that means more and more calories, and that can affect at some point your weight loss. So move to a solid diet. Keep exercising. You should be taking vitamins, and at this point it's probably likely that you can stop the consumption of omeprazole or acid suppressant medications. At 3 months, we do the first blood work. So you should talk to your doctor, have the orders for the blood work, and give the results to the doctor. If you have any deficiencies there, we can correct them just by taking vitamins or iron or calcium, whatever is necessary. You're gonna be losing weight for the whole year, first year. So if you're at 3 months, your weight loss should be significant. You should talk to your doctor and see if the rate of the weight loss is what is expected. If not, take a look at what you're doing with your diet and take a look and review if you're exercising enough. If not, try to do it. Exercise is very important, and the sooner the exercise, the better the effect on the patient who is losing weight. Your next appointment is going to be in 3 more months, that is 6 months after the operation. Goodbye.